How to sustain your relationship with a partner with biconjugate uterus and a polycystic ovarian syndrome. Hello, welcome back. My name is Moses. You see, these days I've been sharing my experience on what I went through, which of course some doctors have already mentioned they are not too sure, but in all it's God's miracle. So I have the platform, so I have to share my experience here. But what I do on this channel is relationship videos, dating, relationship to marriage video. If you're dating to marriage, then my content will be good for you. And of course, if you're watching my video or you're watching my face for the very first time, I will suggest you click the subscribe button and of course stay on the channel, because I talk relationship to marriage, especially when you're dating to marriage on this channel. Like I said, I'm not stopping my relationship videos, but I have the platform, and of course it's part of marriage, it's part of dating, because you date to relationship before marriage. And some of the things I have, or what I went through, of course is in line with what every woman goes through today, or is in line with what what happens to a lot of people today, and more people are going to experience it. And that is why I choose to share my experience here. I'm not talking about biconjugate or medicals on my channel here, but I need to share with women, because a lot of women are going through this, and a lot are still going to go through this. And of course, I decided to share my experience on my channel because it's along the way. Because if your journey into marriage, into relationship, into marriage, family life, it's part of it. And that is why I share my experience here, to help a young woman out there who is in marriage and who is about walking into marriage. Now, like I mentioned, I said how to sustain a relationship or your relationship with a partner with biconjugate uterus and a polycystic ovarian syndrome. Number one is that you stay together. You must plan to stay together with your partner. Plan to join together with your partner. Number one is plan to stay together with your partner. Number two is plan to join together. Whatever your partner is doing, especially the ladies, I knew what I went through, because when I was going through those things, like I mentioned, I have always said it. My first pregnancy was good. Everything was fine. I never knew anything. It was fine until my baby came. But the second pregnancy, of course, when I have all the experiences, and of course I needed my husband around. My husband was back in the United States. Of course, he was not available with me, so I knew what I went through. Like I said, join together. Make sure you be with your partner, especially early detection is very important. Number one is for you to stay together. Number two is for you to join together. And number three is early detection. And of course, like I used to advise people those days when I'm counseling young women going into marriage, I tell them, if you have your way, like my experiences when I was growing up, how I sensed something was wrong after the doctor said was that I have this painful menstruation. Before my menstruation comes, it's always very painful before the day of my menstruation. So early detection, of course, if your doctor tells you after your first or second pregnancy and you still intend to go into more pregnancies, early detection is very important. And of course, it's good when you detect it, and of course, be with your partner. Don't forget, number one is stay together. Number two is join together. Number three is early detection is very important. Number four is that you make your outings together. It's very important, because most times when your partner is left alone, it's always not an easy time. So make your outings together. Stop smoking if you smoke. Of course, if your partner smokes, you have to tell your partner to stop smoking. It's very important, because it will help her to be able to do better, because sometimes these smells and of course things that are not good in pregnancies are not good. Your partner must stop smoking. Less stress is very important, because it will help her to do better, and of course rest well. Give yourself time together. Be together, pray together, joy together. Give your time together. Give your partner enough time to do what she wants to do, so long as it's decent and it helps her in pregnancy. It helps your family. Excuse me. Be open to your partner as your partner is open to you. Read about what is happening to her. Read about ways out. Read about how to encourage her. Do good dieting together. Do good meals together. Cook together. Eat together. Joy together. The next one here, I have mentioned up to 6, 7 right here. Don't forget. The next one here is that you do some outings together. Like I said, I have mentioned that do some outings together. And of course, the last one for me here is that you have to be patient with your partner, because it comes with pain, and your partner needs some patience from you. It needs some encouragement. I will go through it again. Number 1 is that you stay together. Number 2 is that you joy together. Number 3 is that you make outings together. Your partner must stop smoking. That's the next one. The next one is that less stress is important for your partner. Encourage your partner to do less stressing, less of driving, less of too much cooking, less of doing so many outings that are not important at that point. The next one is that you must find time to be together, spend time together with your partner. The next one is that good dieting together, good meals together, cooking together, joy together. Most of the times, as a partner, you have to cook for your partner. Just make her happy is important. Be open to your partner as your partner is open to you. The next is that you do outings together. The last one is that you're patient with your partner to make the whole thing work together, because you have to be together. And of course, if you have not subscribed, like I said, I do relationship videos, dating to marriage videos on my channel here. And of course, we are not deviating, but I need to share these informations to school someone out there. Someone needs this. And of course, YouTube, I am not stopping from doing my normal relationship videos. But of course, what I'm talking about has to do with relationship to marriage too, which of course is to help a lot of young ladies who have not really understood what is happening to them, or what has been happening to their pregnancy, their loss of pregnancies, their bleeding and all that. So this is just to help a young woman out there. So like I said, your subscription is important. Your comment is important, because it will help me to respond to your question. And of course, it will help someone out there to learn too. The sharing is important, especially to groups where you have a lot of women. We need to school ourselves, and we need to lecture ourselves, teach ourselves a lot of things here. God bless you, and I'll see you in my next video. From here is love, and I remain your and Moses on the True Ways Relationship with God and Man. Bye-bye.